Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What is the difference between rheumatoid and osteoarthritis?
Rheumatoid arthritis is a form of inflammatory arthritis, whereas osteoarthritis is a form of degenerative arthritis. Inflammation, the cardinal hallmarks of which are redness, warmth, swelling, tenderness, and loss of function, is a process in which the cells in the joint lining, the synovium, proliferate and divide more than they should. To feed these rapidly dividing cells, blood vessels come in and bring white blood cells that release chemicals which cause these signs of inflammation. Rheumatoid arthritis results in bone destruction. In osteoarthritis, on the other hand, the primary process occurs in the cartilage, and it's sort of like broken shock absorbers. The cartilage takes on too much water and it becomes less distensible, and the forces that you normally bear on your joints are transmitted to the underlying bone, and this bone remodels, forming larger bone, destroyed joints, and pain and loss of function.
How does someone know if they have arthritis?
The most common symptom of arthritis is joint pain. If you have a joint that hurts when you move it, if you have a joint that's swollen, a joint that doesn't move quite as much as it should, that's often an early sign of arthritis.
What are some treatments to ease the pain?
The most common treatment to ease pain is over-the-counter acetaminophen. Acetaminophen, which goes by various brand names, perhaps most commonly called Tylenol, is a drug that does not necessarily suppress inflammation but decreases pain, does not cause significant stomach problems, and is not addictive.
You see a lot of commercials about rheumatoid arthritis. What should people take from them?
Best treatment for rheumatoid arthritis is to come see a rheumatologist to be evaluated and assessed and prescribed the appropriate treatment. Commercials that you see on the evening news are for the very expensive biologic targeted therapies. These drugs such as Enbrel, Humira, and others, are incredibly effective but are not necessarily appropriate as first-line treatment for all patients with rheumatoid arthritis. Whereas these drugs have revolutionized the outcome of rheumatoid arthritis, preventing permanent joint damage, patients with rheumatoid arthritis should first seek the recommendations of a rheumatologist, and the rheumatologist can really help.
Tell me, how can treatments change if symptoms exist over time?
We initially treat patients with medications that suppress the proliferating joint lining, decrease pain, decrease swelling, and improve physical function. But over time, if these medications are not adequate to completely control the joint inflammation and do not lead to what we would call remission, then we will add additional medications such as these biologic targeted therapies which one sees advertised on the evening news.
What lifestyle changes can a person make to ease arthritis pain?
The best lifestyle change to make is to eat an appropriate diet and to maintain a healthy body weight. Obesity is one of the most important predisposing factors to degenerative arthritis or osteoarthritis, but certainly obesity decreases the response to treatment for all forms of arthritis and increases the stress borne by each joint, leading to increased pain. For a patient with arthritis, it's always good to try to keep moving as much as possible. If you don't move a joint, the joint oftentimes will contract and lose function. For a patient who experiences joint pain, applying heat or cold, whichever is more comfortable, is beneficial.
And at what point should someone stop tolerating pain and see a rheumatologist?
When you experience joint pain, it's a good idea to come see a rheumatologist, because some joint pains are due to soft tissue inflammation, tendinitis, bursitis, and can be treated very easily and readily and resolved completely. However, it is best to catch rheumatoid arthritis, psoriatic arthritis, and other forms of inflammatory arthritis as early as possible and initiate what we call disease-modifying anti-rheumatic drug therapy to alter the course of the disease so that you don't end up experiencing joint destruction and permanent loss of function.